Hi, I'm Vicky. I'm one of the neurodisability nurses based here at Reigate within the Neurodisability Service. Part of my role is to advise and signpost families once their child has received a diagnosis of autism. I feel it's really important that families understand what having autism means, as this can help them understand their child further. For the next few slides, we're going to explore what having autism means, and hopefully you will gather a greater understanding. Before I continue, I would just like to share with you a short animation called Amazing Things Happen.
We are all different, and that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye colour, and so on. Other differences can't be seen. Our favourite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects the senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same world. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We all develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking them. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share that view with us. Autism can make amazing things happen.
This clip is available on YouTube and has been translated into many different languages should you need. This clip can be a really useful tool in order to introduce autism to your wider family, to siblings, and also to your child. So what do we know about autism? Autism is a neurodevelopmental condition, meaning your child's brain has developed slightly differently. They have always been this way and they will continue to be this way for the rest of their lives. It is estimated between 1 in 100 people receive a diagnosis of autism, and the National Autistic Society estimate that 700,000 people have a diagnosis within the UK. Historically, boys have always received a diagnosis more so than girls. Girls' presentations can often be quite different to boys in that they often mimic and copy behaviours. Therefore, the signs are not always as obvious. Research is ongoing and greater understanding is known about autism in girls. Therefore, girls are getting their diagnosis sooner and getting the help they need. Finally, there is no known cause for autism. We know there is a genetic link, as we know it runs in families, and it can also be linked to some genetic conditions. I want to reassure you that there is no evidence out there to suggest that autism is linked to poor diet, parenting styles, infections and immunisations. Autism is a spectrum condition, therefore people share similar qualities, but the impact of these vary from each person. We like to move away from thinking of the autism spectrum as linear, so people not being very autistic to people being very autistic. We like to see it as more in strengths and weaknesses, like this image here in the clip, where each colour resembles strengths, and that is the same for your child. We know that children will have periods in their life where they will struggle more so than others. So you may have heard of different labels which relate to an autism spectrum disorder, such as ASD or autism. There are others such as pathological demand avoidance, PDA, or Asperger's syndrome. All of these fall under the same brolly as an autism spectrum disorder. However, if strategies around Asperger's might suit your child more, you may see this in brackets, and this would be an indication that strategies around this would support your child further. The same for PDA. Autism can be associated with other neurodevelopmental conditions such as ADHD, which is attention deficit hyperactive disorder, DCD, which is developmental coordination difficulties, formerly known as dyspraxia, language difficulties, tics, epilepsy, mental health, sensory processing, dyslexia, and learning disability. Many children with autism just have autism and no other neurodevelopmental conditions. However, if you feel your child has other neurodevelopmental conditions, please speak to your clinician regarding a re-referral on for further assessment. For this next section, we're going to focus on some more of the difficulties that you may experience with your child. We're going to explore 4 areas that your child will find difficult. That includes social communication, social imagination, social interaction, and sensory differences. So for the next few slides, we're going to explore each individually. Please remember that your child will have their individual report which will explain their difficulties. Social imagination is the ability to see things socially and how they interact and influence with each other. Let's think about an example. So for example, going to the doctor's for an appointment. It's expected you will go into the doctor's surgery, report with the receptionist that you've arrived and you will take a seat. You may be aware that people will come before and after you and you may not be seen on time. Socially, you are adapting to your environment. However, people with autism can really struggle with those adaptations because they expect things to be done methodical, so would expect people to be seen in order and would definitely expect to be seen on time. So if their appointment was to overrun, they would struggle to see that the doctor might be late or the previous person may have needed a longer appointment. So they will really struggle to put that together, and that can cause increased anxiety. Social imagination can also link in with a strong need for sameness. So we know, I'm sure you've recognised with your child that they often like things to be the same and they display repetitive behaviours. And also they often have a highly focused interest. We will explore those further, but they all link in with social imagination. People with autism can struggle to communicate and interact with each other. They can also struggle to understand why people think and feel. This is why it is important that we try and understand the autism diagnosis and see how they see the world. For this first slide, we're going to explore social communication further and some of the difficulties you may see with your child. Let's think about language. Some children with autism have no language, while other children have a lot of language. Irrespective of the amount of language your child has, they will struggle to use language socially and also struggle to read the social cues of others. Conversations can also be quite difficult for your child. So having that bat and ball conversation of knowing when to pause and to have a break, they will find that quite difficult and quite often will just want to talk at you and offload all the information they want to say. Thinking about the language that they use. Children with autism will often mimic and copy language. So you may see them copying their favourite cartoon character or mimicking yourselves with some of the language you use. And sometimes it can be that you assume they've got the understanding, but actually what they're doing is just copying the language. Often in clinic I will hear a quite strong American accent and you would think that children have got some association with America, but actually they're born and bred in Sheffield with parents who live in Sheffield, but they've just acquired this way of speaking. Children with autism are also very literal in what they interpret regarding their language. A common thing I will frequently say is give me a minute. And what I don't mean is give me 60 seconds, which is a lot of what the children kind of think that I mean. What I mean is I'm not ready yet, give me some time. But because of the language I've used is very literal, they will assume that. This goes along with idioms and jokes and things that often they struggle with that and will have their own unique sense of humour. This can cause them a lot of stress, particularly in teenage years when, teenagers develop their own language and quite often your child might not totally get what's going on. Finally, the last part on this slide is to think about non-verbal communication. So 60 to 70% of our communication is non-verbal. And your child will struggle with kind of facial expressions, hand movements, eye contact, all of that they will find difficult. In clinic, I've seen some children who will stare intently at me and that will feel, uncomfortable, and other children who will just look away and will just, not want to have any eye contact. Missing that part of communication can mean your child can miss a lot of vital information and their responses can therefore be inappropriate. And it's important that we try and understand that a little bit more. When it comes to social interaction, this again can look very different for each child. You may have noticed that your child's not necessarily bothered about being with other people. They're quite happy to be on their own, and actually being with other people can cause them a lot of stress. This can be quite hard as a parent. We are quite social creatures, so seeing your child on your own can be quite difficult, but it's important to remember that actually they might quite like that time by themselves. Children with autism can struggle with social interaction, so how to initiate an interaction. So sometimes they will hit their sibling or wrestle with a young child in the playground because that is an instant way of getting, an interaction. Older children will often focus on their topic of interest and will come to you and want to talk about their topic. Thinking about social interaction and what we've already said about social communication, friendships can be quite difficult for children with autism, and that's mainly because they like to hijack the situation, so they like things to be running their way. And if the game playing is as they want it, that's fine. But the minute someone else comes in and wants to take over and do things differently, your child may struggle with that and actually take off and say, I'm not bothered with that. And quite often they can focus on just one friend, which can be quite difficult. And as a parent, it's quite hard to not necessarily see your child with many friends. With girls, quite often friendships can be more that they copy behaviours. People with autism can struggle with game playing, as they always want to win and always want to be the best. It's part of human nature that, we want to win and we want to be the best, and being graceful in defeat can be really hard, and it's quite a social thing to adapt. So over time, your child may learn this through the use of social stories, but initially they may find this really difficult. Finally, your child will struggle to understand and pick up feelings of others. They're going to struggle to understand their own feelings. So they're going to need some more work with you in able to establish their own feelings. And then hopefully that will transpire that they will then begin to understand other people's feelings. Some children can come across as being over anxious regarding other people's feelings, but equally that can be that they're not totally understanding this, and it can cause a lot of anxiety and need additional support. We've already mentioned that children with autism like things to be the same. They may interpret this as why do I need to change? I've always done it this way. Why do I need to change? They may feel anxious or upset with unfamiliar situations, and this can cause an increased amount of anxiety. Often children with autism like to do the same things over and over again, and this can include watching the same TV programme, playing the same game, spinning on the same spot, but this is often something that they do find relaxing. As we have just identified, people with autism can like to do the same things over and over again, and I'm sure you will have noticed that small changes can affect your child. The simple walk to school, if there is roadworks, meaning you have to drive a different way or you decide to walk a different way, this can cause a lot of anxiety. Unfortunately, life is not routine, and we cannot make the world so predictable for your child. They're going to need to adapt to change. There'll be periods in their life where change is more problematic. If we think about the school year, the time in September when they're going into a new class, that can be really difficult for them and take them a little while to settle. The period leading up to Christmas can also be a little bit tricky, just because parties, and routines change. And again, similarly for July, things are changing, things are ending, parties, sports days. All those things can make it difficult for your child to adapt. With friendships as well, people with autism often like things their way, which again can cause issues around kind of friendships, and they often have their own agenda, so they want things to be their way. This can make parenting quite challenging, because often as a parent you will need to give into your child with autism more so than possibly your other children. And it's very much can be around picking your battles really and working out, do I need to do this or is there a different way around? And that can be quite difficult with family dynamics at home. But to make your life easier, I would definitely recommend thinking about picking your battles. And then finally, thinking about the strong needs for sameness is linking into those sort of repetitive behaviours that, we do see children with tics, vocal tics and motor tics, and all of them can link into increased anxiety, particularly around their strong need for sameness. Children with autism can have highly focused interests, and we've seen all sorts at Reigate: dinosaurs, cars, trains. I even had one young boy who was intensely interested in Donald Trump, and he had his bedroom all kitted out with Donald Trump. We had another young boy who came into us at a young age, very interested in balls, and he went on to be the youngest umpire down at the Crucible Theatre. So quite often your child's intense interest can lead on to greater things. There can also be phases, so they may just have a phase where they're really interested in one certain topic and then they will just move on. But sometimes it does stay lifelong. Highly focused interest can be a really good time for your child to relax and enjoy something that they like, so they can hyper-focus in that. I think it's really important to recognise this as really valuable time and to have breaks for that, particularly kind of after school and things, that your child, has a time when they can just de-stress, because the social world that we live in is really stressful for them. So let's recognise what de-stresses them. People's special interests can also be a way of starting conversations and a good way of developing friendships as well. So if your child is interested in a particular topic, getting them on the same chat with other children of similar interests can be really helpful. Here is a young person's quote of their description of their highly focused interest. "My mind is constantly whirring with thoughts, worries and concerns. The time spent with my obsession was the only time in which I had a clear mind. It gave me that much sought after relaxation." Children with autism can experience over or under sensitivities to their senses. This can therefore affect their hearing, touch, vision, smell, taste and proprioception, which is the body's awareness of position and movement. Each child has their own profile of sensory needs, and this may change over time. It's important to recognise that some children have increased sensitivities, particularly around stressful times. Sensory impairments can be different for each child, and it can be quite difficult to express them to you or for you to become aware of them. Some of the common ones that we often see is particularly around noise. So hand dryers are particularly problematic. And noisy corridors, noisy, classrooms can be really difficult. Taste is also another one that we often hear about, and that can be around, children having a very beige, bland diet, so they stick to the same foods and they don't venture off their set foods. On the flip side of that, we do have some children who try anything, the hottest curries that you can find, they're happy to give it all a try. And some children even eat non-food items such as plaster and soil. But all of that is either end of the spectrum. If we think about clothing and fabric, that can also be really tricky for some families. Some children like really tight clothes, while other children like really baggy clothes. Tags in clothing can also be really difficult, and often, parents cut them out just to make life a little bit easier. Some children like to wear the same clothes, so they refuse to wear anything else, and parents have a couple of changes of that same set of clothes. School uniforms can also be very tricky, and it's about managing that directly with the school. Children with autism can also express pain differently. So some children we have had presented at A&E with delayed fractures because they've not recognise their pain. They may have a high pain threshold, or they may not be able to express that they're in pain. On the flip side, we do have other children who experience the slightest of pain and find that really difficult. Finally, children with autism can be quite fidgety and struggle to sit still. Some children like to flap. Some parents are keen to give their child a hug, but often the child won't want that. They will want an intense squeeze rather than a hug. I think it's really important just to recognise your child's individual sensory needs. There is a sensory workshop, so please speak to your clinicians regarding onward referrals where you can understand this process more. I'm just going to share with you now a short clip which may highlight your child's sensory difficulties. The clip is loud, it is meant to be this way, so if you yourself struggle with sensory processing, you may find it a challenge. I've obtained some quotes from people who have tried to explain their sensory difficulties. Smells like cats, dogs and deodorants are so strong to me, I cannot stand it, and perfume drives me nuts. Do you hear noise in your head? It pounds and screeches like a train rumbling through your ears. If I get sensory overload, then I just get shut down. You get what's called fragmentation. It's weird, like being tuned into 40 different TV channels. Every time I'm touched, it hurts. It feels like fire running through my body. I'm sure you're all thinking that having autism creates nothing but difficulties, but I want to reassure you there are many pros to having autism, and this can include having the ability to absorb and retain facts, to pay close attention to detail, offer a methodical and logical approach, to have a unique thought process and show integrity and honesty. Please remember that your child has their own personality, and having the diagnosis of autism is a way of them getting the support they need. Here are just a few of famous people who you may know who also have a diagnosis of autism. So Jessica Jane Appleton, she won a gold medal in the Paralympics. Anne Hegarty, she is the personality from The Chase. Bill Gates is the Microsoft self-made billionaire. Anthony Hopkins is the renowned actor and producer. Talia Grant is a Hollyoaks actress. Chris Packham is famous for his work around sort of wildlife. And finally, Greta Thunberg, who is the teenage climate change activist.